Good morning. My name is Sharon Pettit, and I'm here to speak with you all today about stroke and mental health in Georgia. I became interested in this topic while doing research on strokes in Georgia. While there is research showing that mental health symptoms are common after stroke, I found an article that suggested a link between mental health symptoms before stroke. Concerned with the prevalence of stroke in Georgia, I became curious to learn if primary practice health centers are asking important questions of patients who already have risk factors for stroke. I have gathered you all here for this brief meeting to discuss stroke and mental health in Georgia. Stroke or brain attack is a medical emergency where blood flow is reduced or cut off to the brain, leading to cell death. Symptoms of a stroke include trouble walking, speaking, or understanding, plus paralysis or numbness in the face, arms, or legs. Georgia has a 14% higher rate of stroke than the U.S. Stroke is the fourth leading cause of death and the number one leading cause of disability in this great state. Additionally, 43 million people in the U.S. suffer from mental illness. Disorders like anxiety, depression, and post-traumatic disorder syndrome often go underreported. Based on a report created for Georgia, 61.1% of adults aged 18 or over did not receive treatment for mental illness. As stated before, mental health symptoms are common after stroke. Feelings of sadness and anxiety can happen because of changes that occur in the brain. Plus, as stroke is a leading cause of disability, patients may no longer be mobile and must depend on others for care. This too can lead a person dealing with stroke to develop depression. However, I was more curious about mental health illness before stroke. Can mental health illness lead to a stroke? Pan and colleagues at Harvard University performed a literature review and found that depression and other mental health illnesses can lead to an increase in stroke mortality and morbidity. Using this knowledge, what is Georgia doing to prevent this problem? I searched for data concerning mental health screenings at primary health care centers. These health centers are awarded federal grants and are required to collect a core set of data on each patient. One of the categories is mental health screenings. As I cleaned the data for this project, I found that only 6.35% of these health centers are screening their high-risk patients for mental illness symptoms. There are only 30 of these health centers in the state. Because people who seek treatment for mental illnesses are 3.4 more time likely to suffer a stroke, it is time to act in Georgia. This state is in the center of the stroke belt, and the buckle appears to be around the coastal plain counties. We have assembled this group here to discuss ways to use this knowledge and prevent stroke in the public we serve. Let's look at an influence diagram that we created before bringing you all here. At the center of the influence map is the patient. Stroke is a preventable illness, and patients must be at the center of any prevention program that hopes to be successful. Next is our aim that doctors, nurses, and other government agencies will influence patients with the knowledge gained from this study. Medical professionals and public health practitioners have a responsibility to recognize mental health symptoms in their patients. Furthermore, if other risk factors for stroke are present in a patient, more care will be taken to ensure that these patients are screened properly. Here I have the influence going in the wrong direction for patients and doctors. It should be the other way. Hopefully our doctors will influence our patients to get screened properly. Additionally, patients who seek mental health care at local facilities should be referred to their medical professionals for screening for risk factors that could lead to cardiovascular problems such as heart attack and stroke. Patients will influence their employers to create wellness plans at the job. Wellness plans may offer a real-life solution to handle chronic stress and may further influence patients to reduce their risk factors for disease. Lastly, as patients will seek out better food options at local grocery stores and farmers markets. They will shop at retailers for walking shoes and wearable health information devices to track their steps or hours of sleep. Some patients may be able to join a gym as an incentive of a wellness plan at work. I thank each of you for joining us today for this workshop. We look forward to all of your ideas and best practices to reduce the incidence of stroke in the state of Georgia. Thank you.